talk about what a day looks like for a new charge nurse who don't know what she's doing. So yeah. Hello YouTube family, this is Nurse Torin. I am back with another video for you all. I hope everyone is doing well. For those of you who don't know, I am a registered nurse. Prior to being a registered nurse, I was an LPN for about approximately 3 years, and prior to that I was a CNA. So I've been in the healthcare for some time. I wanted to come on here and just talk about what it's like being a med-surg nurse, because that's my job specialty at the moment. That's where I'm working at. So I thought it would be cool to just like kind of explain what a day looks like on med-surg. Here we go. So our shift at the hospital that I work at starts at 7 o'clock in the morning. However, you are told to be there at 6:30, 6:45 to receive report, settle into your shift. So typically I get to work around 6:45 on my good days if I'm not late. I'll get there around 6:45. 6:30 is kind of pushing it, to be honest. I no, 6:45, 6:50 is when I make it on time there. And during that time, when I first walk in, I usually go to the break room to unload my tote bag with my lunch. I'll put my lunch away if I bring lunch that morning, and I get out my I get out the things that I know that I'll be using, like my stethoscope. I have like a pen bag that I carry with my highlighter, my pens, any sticky notes that I need, and also my clipboard. So I grab all that, put that together, and then I head to the nurses station. At the nurses station, we have an assignment sheet. So it basically has a rundown of the census, all the patients on the floor, and then the nurses that's coming on duty for the 7 a.m. to 7 p.m. shift. I actually did a little blueprint. So like I said, we'll have the census, patients, and then nurse 1, nurse 2, nurse 3. We'll have who's on call and the open beds. Usually that's what's on the assignment sheet. So under the nurse's name, so under my name, it'll tell me what room I have. So if I'm on the second floor, I'll have room 201 to 206. That's what will be under my name. Far as the on-call, that's for the charge nurse to handle. So if the census go up and we need someone to come in, she'll know who to call. It's on hand. And then the open beds for admissions. That's what's on that paper. So I'll look at the assignment sheet, know what rooms I have. After that, I usually sit down, go into the computer. We use Sunrise as our documentation. So I'll go in the computer, I'll pull up all of my patients that I have for the day, and I just like to look at their portfolio, their profile. So I'll go in, I'll see, you know, when they were admitted, why were they admitted, what's their diagnosis. I like to look up their vital signs from last night, the recent ones that they've gotten overnight, and that's usually around 4 o'clock is when they get them done before we come in. Look at their vitals, and look at any doctor's notes, the last doctor's notes that was written, the summary. So I do a little overview, just so that when I get report, everything can make sense to me. Like I'm hearing it twice. I'm reading it and then I'm hearing it. And if the night shift nurse forgets something, to be like, hey, I seen this in the computer, you know, because I work night shift and sometimes you're trying to give report and go because you're tired, you know, you're half asleep sometimes giving report as a night shift nurse. So yeah, so that's why I do that. So I go into their profile, obtain some information that I can utilize and write down, and then I get report. I find out that I go back to get the assignment sheet, from last night to see what nurse has my patients. So then that's when I'll approach the nurse like, hey, are you ready to give report? Or is there anything that I can help you do that you haven't finished, you know, if they're not caught up by the time I come in. And that's why it's important to get there early. But anyways, yeah, so I will approach the nurse, the night shift nurse, and then we do bedside report. So we go into each patient's room that we have. So if I have 4 patients, I'm going into 4 rooms to give bedside report. And it's crucial to do that because you can actually see that your patient is physically okay. And you can hear your report and see whatever you're receiving in report, you can visualize with your eyes. So this patient's alert and oriented, stable, you know, no complaints. Oh, okay, I can see my patient's alert. We're conversing back and forth, it matches the report that I'm getting from overnight. And at that time with bedside report, I usually, ask my patients, are you in pain? Is there anything I can get you? And then I let them know, hey, I have other patients that I have to go get report on, and I have to get my cart ready with the medications, and I will be back to assist you after that. I usually don't give them a time that I'm coming back, just in case I can't keep that promise. So that's very important. So after we do our bedside report, that nurse is leaving. I will, if the patients did need anything like water or something like that, I'll go back and give that to them. And then I come back and sit down at the nurse's station. And that's when I go over the patient's medications. And I have a little slip that I do. So this is what I call like a little brain. Nurses call a brain. So typically I write out my patient's name, patient 1, 2, 3, 4, and then I write their medications, like their 8 o'clock meds, 11, 3 o'clock, 6 o'clock, and so on. And then in a little tab, I write their labs and their vital signs for the morning time. Usually labs come in around 4 o'clock in the morning. So if there was anything critical, when I first came in, I would have seen that and I would have heard it from the night shift nurse. But I still write it down so that when doctors come in and do their rounds, I've heard it so many times, it rung a bell. Oh, I have to follow up with the doctor and see, what's the next steps. So I write all this down, and then that's when I go in. And also, I'm sorry, sometimes I write down their PRN medication, especially if I hear and report that the patient requests them per scheduled as PRN, like if they get at Q2 hours or Q4 hours. If I have a patient that is on the clock with their payments, I usually write their PRNs down so I know, I may have to pull this when I go into the Omnicell. Okay, so once I write down the medications, I typically go into the med room. That's where the Omnicell is. It's a big computer and medication storage box. And I pull my patient's meds, and I put them in my wall. The work on wheels is the wall, the little computer that you see nurses moving around. So I clean that off, obviously, get that nice and clean, and then I bring that into the med room with me, and that's where I store all my meds. And I grab any material that I need. I grab IV kits, I grab lines, IV lines, alcohol swabs, gauze, anything that I know that I may utilize, glucose sticks, anything. I kind of fill up my cart so that I'm not running back and forth. I have everything that I need. So after I grab my medications, grab all my materials that I need, that's when I start doing my med pass. And typically, so by this time, it should be at least 7:30, 7:45. I should be starting my 8 o'clock meds on a good morning with no interference. So yes, I will start my med pass. During my med pass, I typically do my physical assessment at that time. I like to document my physical assessment once I'm done before moving on to the next patient. However, if I know that it's a busy morning and that I'll be just everywhere and it's not going to be a smooth flowing day, I document my physical assessment later on. But typically 95% of the time, I document my physical assessment while in the room. It's important because you can forget what you assess, mix match the patients on what you assess for this one, put it for that one. So that's why I typically do it in the room. If I cannot do it in that room, and there's an emergency, or I know I have to I'm running late on my meds, I write down what I found for each patient on a piece of paper. If I can't click, I just jot it down under their name on my little paper where I took their where I took report. So anyways, yes. So when I'm in that room, passing their medications, I'm doing their assessment, their head to toe physical assessment. I'm asking the patients, do you need anything? If they need to use the bathroom, I typically would bring them to the bathroom at that time. There's no need in me stopping my CNAs from taking the morning vitals. Hey, can you come bring this patient to the bathroom? You need to use the bathroom. Let's get up, transfer you to the bathroom, or get you out of bed to the chair. especially if they're a surgery patient and they need to get up out of bed in the mornings. So I'll typically do that when I'm doing my morning medications. On a good day, when I have the time, I'm able to do that. So yep, and then after my morning med pass, if everything's running smooth, my patients are okay, I check in with my CNAs, like, hey, do you need anything? Or if they're reporting back any vital signs and I have to ask them, hey, can you take a manual? Or if they can't, do I need to? I try to figure those things out, and then I will take me a little 15-minute break. That's when I try to squeeze in my little 15-minute break. And even if that 15-minute break is sitting at the nurse's station and, you know, going back over their medications and going back, seeing if there was new orders put in, anything, I could spend my 15 just like kind of debriefing and calming down after, you know, doing my med pass and physical assessments. And that typically takes me, with 4 patients, the assessments and passing their meds, that could take like up to 2 hours if you're really thorough. Yeah, it typically takes up to 2 hours to complete. So by, I'll say 10 o'clock, I should be done with my med pass and head to toe assessments. I should be done by 10 o'clock, 10:30. And that's where I could take that 15-minute break at 10:45 until 10:45. And then 11 o'clock rolls around and you got to check blood sugars, and maybe there's another med pass to happen around that time. But that's when doctors also start coming in and doing their rounds. Luckily, where I work at, our nursing supervisor, the unit supervisor, she does round-ins with the doctors, and then she reports back to the nurses on, you know, any changes, who's going home, who's going to who's being transferred out to a nursing home or rehab and things of that nature. So we don't do rounding. The nurses don't do rounding. We kind of, the nursing supervisor takes care of that and reports back. So she'll get report from us, hey, is there anything that I need to know about your patients that you received in report? Or, you know, is there anything that any concerns that you need to let the doctors know? And she goes and relays that during rounding with the doctors. Yeah, so that's about it for like my morning time, my morning routine on a med-surg floor. That's basically what it looks like. And then towards the afternoon, it kind of slows down in the afternoon on good days. And I keep saying good days because like it's not realistic to like just have everything planned out. But anyways, yeah, so during like lunchtime, that's when you'll have a second med pass, and that's not as heavy as the morning med pass. During like the lunchtime, the med pass for each patient probably have like 2 meds or a PRN that you have to pass. So that's, you know, that's more reasonable. And to say like I didn't get to do a head to toe assessment in the morning, I would do it during my lunch med pass. But as long as I see my patient in the morning, I'm fine with even saying, okay, I'll come back for your physical assessment. But I just like to get everything done so I'm not back and forth. And that helps me prioritize. So if there's an emergency, well, at least I had this and that in order. I had all of that done and I can handle this emergency, you know. And then by the end of my shift, or towards the end of my shift, I'm like, oh my God, I forgot to do this. I forgot to document that. I handle all of that first thing in the morning. So yeah, so during the afternoon, the med pass is pretty light. It's not too heavy. They're up for lunch. You know, all your patients should be up at time. If they're able to be up. Physical therapy in the hospital that I work at, they do a really good job coming to get the patients up and walking them for you. However, that does not mean that you have to rely on that. If you have a surgery patient, my hospital, they stress that you get your patients up. You get them up. They need to be out of bed. That blood needs to be circulating. You know, they need to be exercising those joints, those muscles, or whatever, you know. If the physical therapists haven't reached them yet, you get them up. Some patients, you have to wait for PT to come and get them up before you get them up. But those that been working with physical therapy and occupational therapists, you can get them up, get them out of bed, get them up. The sooner the better. So yeah, and then once like the evening roll around after lunch and everything, that's when it starts getting a little busy again. The med pass can be a bit heavy during that time. Sometimes it can be, it's like starting the shift all over again, but towards the end of the shift, make sense? Like you're starting your, like, I don't know, whatever. But yeah, that's when it could kind of get a little busy because especially if you have the elderly patients and they're sundowning around like 5 o'clock, your 5 o'clock med pass. So it's like, oh, okay. And that's when poop hits the fan, literally. That's when things kind of hit the fan. It's either things get really chaotic in the morning, early morning, or like right 2 hours right before your shift is about to end. So yeah, that's towards the evening is when things kind of pick up again, and you're getting ready to go home. And towards the time that I am getting ready to go home after my bed pass and everything, I go through my charting. I make sure everything's charted. I make sure I have my rounding charted. I make sure I have my sepsis tab done. I make sure that I did put in my physical assessments appropriately for the right patient and everything like that. I make sure that the vital signs for the shift was done by the CNAs, that they did each vital sign, because I think they get vitals 3 times a shift, in the morning, lunch, and towards the evening. So 3 times. So I make sure those were done and nothing was out of whack that wasn't reported to me. And yeah, that's about it. Yep, that's like a day on the med surge. That's an easy day on the med surge. A smooth shift. Yeah. So if you like this video, please like, comment, share, and subscribe to my channel. I am almost at 500 subscribers, and I hope that I can just keep going up from here. Any other content that you want, just let me know. I look forward actually to putting out a video on what it's like being a charge nurse, because I was kind of thrown to the wolves, and I'm a sheep, and I can't believe they did that to me. But I handled it well. And I love my supervisor and unit manager. They are wonderful. But yeah, I would like to talk about what a day looks like for a new charge nurse who don't know what she's doing. So yeah, so if you want more content, you know what to do. Let me know in the comments, like and subscribe. Thank you. Bye-bye.